everybody. This is Terry here with Premom with Nurse Practitioner Tina Hickman. We're really excited because we have a really important topic today. Tina wanted to talk about timing intercourse, which I think is one of the most important things you can talk about when trying to get pregnant. So she's going to talk on this topic, and you had a lot of great questions for us. She's going to cover most of those in her presentation, and then we'll follow up with some more of your questions. So please feel free to join us, ask live anytime during this presentation, whatever questions you have, and we may cover some of those at the end.
Hello, everybody. I thought this was a pretty important topic to cover. It seems like when I'm meeting with all of you women on Premom, it seems like this is something that I have to cover very frequently. So this is going to be kind of a short and sweet overview because it is just a lot of bullet points, but it's super important. So I think I'm going to pretty much cover everything that everybody asked in my little talk here, but if the ones I don't, I'll try to answer at the end, and then I'll take questions if you guys have them. So the first thing we'll kind of talk about is this fertile window. So everybody kind of, uses this terminology, fertile window, but I'm not sure that a lot of people really know how to get their fertile window, at least the women I have talked to. So the way you get your fertile window from start to end is you subtract 14 days from the length of your shortest cycle. Okay, so that's the first day of your fertile window. And then you subtract 14 days from the length of your longest cycle, and that is your fertile window. So for example, if your shortest cycle is 24 days and your longest cycle is 30 days, then your fertile window is going to be day 10 to day 16. And that is just simply going off of your menstrual cycles and not any ovulation that you have tracked. So the reason for this is because that phase of the menstrual cycle or the ovulation cycle that third phase is always the same. So it's always 14 days. So you're most always going to ovulate 14 days before the start of that period. So that's why we are subtracting 14 days from the shortest and longest menstrual period logged and telling you that that's your fertile window. So that's step one, which is really, really important, is pinning down that fertile window. For some women, it could be very short. For some women, it could be very, very long. It all just kind of depends. So the next kind of important bullet point is one that's really super important. So you do not want to have intercourse any less than every other day during your fertile window. So I'll explain why that is important. So the egg lives for up to 24 hours. So 12 to 24 hours, we typically say we'd like to cross ovulation 12 to 14, but 12 to 24 is when that egg is kind of going to have its best chances. Sperm can actually live up to a few days. So you can see if you are having intercourse every other day during that fertile window, those two are probably going to cross at some point in time. So a lot of times, I get on and I'm looking at these women's calendars where they're logging intercourse and they're having intercourse maybe the day of ovulation and the day after, and that's it. This is just not going to be adequate, right? So our chances of getting pregnant, just having intercourse that 1 or 2 days during that window, is not going to increase our chances very much. So on the flip side of that, too much intercourse, some people say, okay, well, I'll just have intercourse every day, so I'm bound to hit it. So the problem with that is if you're having intercourse too much, you're actually going to deplete those sperm a little bit, right? There's not going to be very much. If you're having intercourse every day, that ejaculate isn't going to be as thick and heavy and concentrated, okay, as it should be. And then the other side of that is if you don't have intercourse enough, then that ejaculate is going to be, you're going to have a lot of volume, and there's going to be a lot of dead sperm and a lot of immobile sperm and a lot of sperm that kind of doesn't have the right morphology or right shape. So it's really important to remember too much or too less is really not a good thing here. And then when you're talking about abstinence before your fertile window, you do not want your partner to go 3 or more days without ejaculation. So you don't want to have like a 4 or 5 day abstinent spell before your first day of your fertile window, because this is going to, it's going to, you know, you're going to have too much concentrate in your sperm again. So some people say, okay, then I'll go instead of day, you know, if my fertile window is day 10 through 16, I'll start day 8, right? Start day 8 and then 10. And that's okay to do it that way. But just keep in mind, one way or the other, there shouldn't be abstinence more than 3 days before having intercourse on that first fertile window. So the idea, most fertilization happens when the egg and the sperm, obviously when the egg and the sperm meet, but when intercourse happens before ovulation. And this is because it gives the sperm a little bit of time to get where it needs to go. And then, so it's kind of there waiting on the egg once you ovulate, right? So that's why that every other day leading up to ovulation, you know, in that ovulation is important, because you kind of want to have the sperm already there when you ovulate. If you're ovulating and then you're having intercourse, it's going to take that sperm a while to get where it needs to go. And then by that time, your egg could be, you know, gone. So really important every other day. So let me see. Yeah, so I just wanted to touch on, I had a question about timing your fertile window with PCOS and irregular periods. So obviously it's a little bit harder with PCOS because you can't track your ovulation. So the big irregular menses, it's a little bit easier because you can still do your window by the shortest cycle and the longest cycle. PCOS is a little more difficult because we're not even sure that you are ovulating, right? So we don't even, you know, your LHs may be all over the board. This is why it's really important to get to the root of the cause with PCOS, because if you're not ovulating or you're kind of having that high LH surge for a long period of time, you may not be able to conceive anyway. So that's why you kind of, you know, you have to make sure that PCOS is under control. Now, if you have a diagnosis of PCOS, but it's treated and you're having regular periods, then absolutely you can still do the fertile window. But it's definitely important to get that PCOS treated beforehand. So that's a whole nother topic. I did a spotlight on that too. You can watch, or you can get me on Premom, but that's a whole nother slew of issues. But definitely get the PCOS treated if you're trying to time ovulation. Okay, so I'm just going to go over a few myths, kind of myth buster, I guess, with intercourse. So some of them were questions, but some of them are also just common questions that I get as a provider. The first one is position. So position does not matter. It doesn't matter at all, one way or the other, which way you choose to have intercourse, standing up, lying down, nothing. It does not matter. So get that out of your head. It doesn't matter. Gravity also doesn't matter. So if you are, you know, standing on your head after intercourse or whatever, it's not going to help. So that's, you know, the position of your uterus is not going to change if you're standing on your head. The sperm still has to get where it needs to go. It's just not going to make much of a difference. So don't give yourself a headache over that. So laying down after intercourse, there is like just laying on your bed, laying flat. There's no scientific evidence that plays any important role, right? But I mean, logically, you would think that getting up and going to the restroom right after intercourse, you know, that gravity is not going to help. So, I mean, laying down during or right after intercourse is okay for 5-10 minutes, but I mean, there's no scientific evidence that works, but it's not going to hurt you. However, then you need to get up and go to the restroom. The women's health side of me, you should always go to the restroom after intercourse. So I just wanted to add that. Okay. And then the next one is that, so when during the day should you have intercourse? So studies show that there is actually an increase in semen production in the morning, but that increase is actually slight. So if you're unable to have intercourse in the mornings, don't freak out. You can keep it in the evening. That's okay. But if you're somebody who kind of likes to make sure you're hitting every point possible, morning timing has been shown to have a little bit increase of sperm count. So the other thing I just kind of wanted to touch on is the sperm count and how it can be hindered. So this is a little bit off topic with timing, but I just thought it was important to touch on. So the testicles are actually made they're outside of the body so they can stay cool, right? So they have to stay cool to have sperm production. So if testicles get 98 degrees or higher, it actually halts semen production for a period of up to 60 minutes with each time it goes up. So it's really important to make sure your partner is staying out of hot tubs, not leaving a laptop sit on his lap for an hour at a time. Anything that, tight underwear or biking or anything that is going to get that core temperature to over 98 degrees. That's really not a good thing. So I just kind of wanted to touch on that real quick. The next thing is lubricants. So water-based lubricants, like things like KY jelly, Astroglide, those things can actually hinder 60 to 100% of sperm penetration for up to an hour after use. So if you're using lubricants with intercourse and trying to get pregnant, probably not a great idea for water-based lubricants because it can really have a negative effect on sperm penetration. So you want to stick to like oil-based lubricants or nothing at all. There's a couple lubricants on the market that is made for intercourse when you're trying to conceive, but stay away from anything water-based. Some people use things like Mucinex, for instance, when they're trying to conceive, and that's okay, just as long as it is not water-based. And then the last one is just, I've been asked a couple times, and this is just kind of a myth bust too. Presence or absence of a female orgasm does not matter when it comes to trying to conceive. So that is not something that you need to worry about. Believe it or not, there's quite a few people that think that the moisture produced by a female orgasm will help the sperm, but actually there's no scientific studies that say this has any effect whatsoever. So again, no need to worry about that. And I think that's all. Terry, unless you can think of some questions. Oh, I'm sorry. So the sperm meets egg method, the SMEP. So the beginning part of SMEP, so for those watching that aren't real sure, it's just, you can look it up, but it's just kind of a method that says intercourse every other day until the day you ovulate, then 3 in a row, then skip a day, then intercourse again. So I'm going to say I do not usually say do this method simply because I kind of go by studies, evidence-based practice, what have worked in the past for me, and kind of what my books and things tell me. And what I'm telling you today is kind of the way that I have seen the most success. Again, with the SMEP, it's telling you to have intercourse every day after ovulation, which I kind of already discussed usually doesn't really have a huge impact. So I guess my final answer is no, I don't really love that method. But again, I think your best bet for a method is every other day intercourse between your fertile window, point blank, end of story. I really think that's the best, gives you the best chances. And I think that's it, Terry. Do you see any other questions that I missed?
I think those were, I was just double checking and triple checking. I think those were mainly covered already. I'm checking live now. Yeah, someone just asked again about having sex after ovulation, and you were talking about how that's not as important. You want to make sure the sperm's already there, right?
Yep. And again, I think that during that fertile window, I want you to make sure you have intercourse every other day during that fertile window. And that's not really to hit intercourse after ovulation. That's just to make sure ovulation isn't happening the last day of your fertile window. So yeah, most pregnancies happen when you have intercourse before about 12 hours before ovulation.
Yeah, I think that's about it for live so far. Just a comment, the tracking is hard. And someone did mention that they have PCOS. I just wanted to add in there too that Premom will help you track your fertile window too, so you don't have to
Yes.
the
Yes.
timing. Nice. Technology is wonderful.
Yes.
Someone asked your thoughts on having intercourse on peak day or ovulation day, one or the other, if you had to pick one.
I would say just if it falls every other day in that window. Again, like if you get a positive ovulation, say you get a positive ovulation on Wednesday, but you had intercourse Tuesday and you're set to have intercourse tomorrow, that's fine. Don't overdo it. I don't want you to, kind of freak out and say, I have to have intercourse on the day I ovulate, because that is not true. We're tracking ovulation because we want to know if you're ovulating, and we want to get you a good fertile window. Like Terry said, that's kind of the point of Premom, is to make sure you are ovulating and make sure you're regular, and make sure as providers that we can see what those levels are and see if you are actually ovulating. But don't bog yourself down in, oh, I got a peak, I have to have intercourse. That's not the case. Again, because that sperm and that egg are going to live. So if you get peak day on Wednesday and you had intercourse on Tuesday, I think that's perfect. That's a perfect coverage range.
Okay, great. I think, we did have a question about Mucinex, which I believe you touched on.
Mm-hmm.
Someone's asking, why does taking Mucinex help sperm?
Yeah, so it actually just helps your cervical mucus. So there's a little bit of evidence that actually says that it makes your cervical mucus more favorable to sperm, and it kind of helps you get that egg white cervical mucus. So just be careful with that. Again, I don't want to wreck it. Definitely don't start taking something without talking to your medical provider. That's really important. And they can kind of guide you through the safe times to take that. But I just wanted to kind of throw it in there because I know a lot of people that I have talked to who are using these lubricants and stuff are trying to find a safe way to get away from using the water-based lubricants, because they're actually can hinder a little bit. So again, talk to your healthcare provider about that, or reach out to me on Premom, because I don't really want to pinpoint any medications or anything on here, but it is a possibility if you get the right direction for it.
Thank you so much for being on again. Can't thank you enough, Tina. This was wonderful. And thank you to everyone out there for all of your questions. We had a great turnout today. And we will see you again soon. We'll see you Friday.
Absolutely. Thanks.